Mimi ni community health promoter na kuanga hapa Biafra facility. So shughuli ya leo imekuwa kuhamasisha the community about cervical cancer and breast cancer, actually cancer in general. And then also tunaongelesha kuhusu cancer inaleta madhara gani kwa community. Also tunafanya family planning kwa wale wa mama wa area hii. So the uptake imekuwa sawa, watu wanakuja, tunaona watu wanaendelea kukuja. Hii age kutoka 18 mpaka 35 ndio naona wanakuja sana sana. Hao wamama wazee sijaona wakikuja wengi. Na naona wanakubali, especially the cervical cancer, naona wanakubali kuangaliwa. Kuna wale wako waoga, kuna wale wanaogopa, lakini tunawaeleza na wanakubali. Pia kuna wale pia wana documents, mtu anasema mimi sina ID, sina nini, hamtaweza kuniangalia. So unapata challenge pia ya SHA. Kuna wale wanasema kama hujaregister SHA hautaangaliwa, lakini tunawatoa hiyo mawazo yote, tunawaambia hapa leo tumekuja, kuna maneno ya SHA, kuna mambo na kukataa. So tunawaongelesha na most of them wanakubali. So challenge wanakataa ni hiyo tu. Ningeweza kusema ni vizuri hii activity ya leo kweli imekuwa ya manufaa kwa community. Hapa especially hapa ni kwa kijiji. Most of the wamama wale wako hapa area ni wale hawaendi hospitali. Kwa hivyo tukiwaletea shughuli kama hii wanajitokeza kwa wingi na unapata wanafaidika. So nahamasisha wamama wajitokeze kwa wingi na tunaendelea kumobilize. So cancer is real, lakini kigunduliwa mapema inapona.
And ukiangalia hapa kando yangu niko na team DG. Nataka ni appreciate sana kwa hii platform whereby wameshikana na wakacoordinate na team zingine kuleta hii mambo ya cancer mtaani. Na ndio the first project whereby tumeona imekuja hapa Kanuku Kinyago village. Mimi kama youth leader hapa, I'm so happy to see hii event inaendelea na na appreciate sana vitu kama hizi. Viongozi wanaweza learn kutoka kwa team DG na wale coordinators wengine, vitu kama hizi ziko zinatufikia mtaani. Hii ni platform poa sana because kuna wamama ambao hawawezi enda hospitali lakini saizi wanatibiwa. Saizi kwa record ile ambayo tunaangalia hapa, tunaona saizi ni kama wamama I think 105. Saizi wanashughulikiwa pale mtaani hapa Kinyago Kanuku village, na tuna appreciate sana hii platform na wale coordinators wote ambao wamehusika, wale viongozi wote ambao wamehusika, tukianzia na county, tukikuja team DG, tukikuja na organizers zao wa hizi dreams na manini za wasichana. Tuna appreciate sana. Hii ni platform poa sana mtaani na tunaomba iendelee hivyo kila constituency na kila ward na kwa kila vijiji. Na pia mambo mengine ikiwezekana kama hii free medical camps, pia hii event inaweza kuwa the best place ya kuhost hii mambo ya free medical camp. Tuna appreciate sana na tunasema Mungu awasaidie na awabariki sana.
Today I've come this way. I went for breast checkup and cervical checkup and I found that I'm fine. Right now, as I'm here, I'm very happy that I've known how my health is, and I appreciate all the people of this team. That thank you for what you have done, and I hope next time again you will come back and test more again.
And Being Africa is a non-profit organization that does mostly community awareness. We do a lot of research on issues to do with non-communicable diseases, which includes cancer, diabetes, and hypertension, and all other non-communicable diseases. So part of what we do as an organization is community engagement, because we realize that most people within the community suffer most of these non-communicable diseases, and they are unaware. And those who are aware are disadvantaged, in terms of access. They are not able to access some of these services, information. There's a lot of stigma within the community that disadvantages most members of the community. And we are seeing a number of people within the community just dying out of these diseases, and not because they have the information, or not because that the disease would kill them, but the message that we have for the community today is early detection will save lives. So we are here as part of our breast cancer awareness campaign, where we are intending to raised awareness about breast cancer. We are offering screening services for the members of the community, and since it's the same woman we are talking about, we are also offering cervical cancer screening, because breast cancer and cervical cancer are among the leading cancers in the country today, that's killing thousands and thousands of women. And like for instance, cervical cancer kills 9 women every day in the country. So that is over 3,000 women dying in an annual basis. So that's why we felt it was important to come to this community, Kinyago community within Kamukunji constituency, just to raise awareness and bring these services closer to them, and see whether we can address the issues of stigma, to see whether we can encourage members of the community just to come in for the test. And even men have been encouraged to come, because breast cancer and cervical cancer is not a woman issue alone. We are encouraging men also to come and start this conversation, so that, because men are the caregivers to women who suffer cervical cancers and breast cancers. So we find it is important to bring them into this conversation. That's why when you look at our today's event, we have a large number of men who've turned out and women who've turned out. So we have we thank God, because the turnout is huge. The members of community have responded to our messages, and they are here to be tested, they are here to learn, and they are here to take the positive step. So it is a positive thing for us, because this is where change happens. Change happens within the community. If the community members have the right information, they take the right steps, like screening for those of us who will be found to be to have precancerous lesions. The community health facility, the Biafra, will be doing the treatment. They are screening and treating. So members of the community are benefiting double here. They're getting information, they're getting the services, and they're getting treated. Also for breast cancer, they're also being taken through the screening processes. And we just love this. And members of the community are getting the information. So for us, as Being Africa, we are happy. And this is basically what we like doing, going to the community, reaching out to the community, and ensuring that they get the right services at the right time. Yes, I would just want to call upon the government to prioritize issues of non-communicable diseases. And some of the things that the government can actually prioritize are things that don't require a lot of resources. Raising awareness. I'm sure the government has a lot of resources. We need to use the conventional medias to raise awareness about issues to do with non-communicable diseases. We would like the government to avail screening services in all public health facilities, at the primary health care all the way to level 6. We want these services to be accessible. We want these services to be affordable, because you find some of these services are there, but they are not affordable, So the government needs to make them affordable. Just the day before yesterday, we had a petition that we were delivering to different government actors, because SHA is not working for cancer. Of course, SHA is a good idea, but it's not working optimally. People with terminal illnesses and these terminal conditions are suffering, because they end up exhausting their covers in midway of their treatment. So we would like the government to consider that and ensure that these conditions are addressed at the required time, and we are able to save our women. Because at this day and age, cervical cancer should not kill people, because it's preventable and treatable. Breast cancer should not kill people, because it's preventable and treatable. People can prevent breast cancer when they do screening, and it is detected early.